The Department of Chemical Pathology at the National Hospital of Sri Lanka serves as a cornerstone in patient care. Welcome to a day at the Chemical Pathology Laboratory. We receive various samples, the lifeblood of our diagnostic work. We categorize the samples immediately from fasting blood sugar to 24-hour urine sample. The medical laboratory technologist carefully check and number the sample and allow it for centrifuges. Before we run a single patient sample, we must prove the machine are telling the truth by performing rigorous quality assurance checks.
Internal quality control is our daily safety net. By running non-control samples alongside patient samples, we ensure our equipment is precise and our results are reliable.
External quality assessment is our blind audit. We test unknown samples sent by an outside agency to see how our results stack up against other labs.
Samples are vortexed, diluted and prepared with PEC when required. A young man admitted to emergency treatment unit with chest pain. His ECG shows non-ST elevation and suspected non-STEMI. The team needs an urgent troponin. We release the report to the doctor's desk within 40 minutes. Behind every result is patience, precision and purpose.
High-sensitivity troponin assays has revolutionized the management of acute coronary syndrome in the emergency department. It helps us to detect myocardial injury early, rule out, rule in myocardial injury, which enables us to provide timely care for people with acute coronary syndrome. I am eternally grateful to the NHSL laboratory for providing us with this opportunity.
At the fluid bench, every sample tells a story. A simple urine strip reveals chemistry in seconds, but the real insights appear under the microscope, where cells, crystals and casts guide clinical decisions. Science quietly changes lives. Whether it is clearing a patient or calling a ward to report critical high calcium, requesting a sample for urgent parathyroid hormone levels, and ultimately aiding in a hyperparathyroidism diagnosis.
Biochemistry laboratory is very important in managing patients with high calcium, because we need to know what is the reason. Is it due to high parathyroid hormone or the other causes? Even if it is high parathyroid, we need to see whether it is coming from the parathyroid or elsewhere. So we need to do the basal level of parathyroid hormone with calcium, and sometimes during the operation we need to see whether we have taken the culprit lesion. For this, the excellent support from biochemistry laboratory is very important.
When equipment fails, our on-site team responds immediately. Within minutes, the system is recalibrated and back to routine. Serum and urine osmolality levels measured precisely via freezing point depression technology. When a report shows severe hyponatremia, could it be adrenal insufficiency? By adding a cortisol test on the same sample, we often find the missing piece of clinical puzzle.
Now in this patient, we have diagnosed hyponatremia, and the lab has supported us to come to the conclusion of additions with quick and relevant investigations, because it's important and vital to diagnose Addison's disease. We need to follow it up with further studies like short synapton test. That again we need to depend on our lab. Italy, they have been helping us with prompt and accurate diagnosis.
From initial protein separation to targeted immunofixation, we identify abnormal immunoglobulins with high specificity, delivering the clarity needed for complex clinical diagnostics. Using high-performance liquid chromatography, we precisely separate hemoglobin variants based on their chemical affinity. Liquid chromatography paired with mass spectrometry offers elite sensitivity for drug assays. The afternoon moves into specialized reporting. Education is constant here. Trainees correlate history with results under senior supervision, ensuring the next generation is as sharp as the last.
This is only a glimpse of work in a busy day in our busy laboratory. So by looking at sodium results, we were able to diagnose Addison's disease in a patient, and by just looking at calcium results, we were able to detect primary hyperparathyroidism. Then by interpreting high sensitive troponin values in a patient who presented with acute chest pain but no ECG changes, we were able to diagnose acute coronary syndrome. So this shows that biochemical investigations are very important. When we do them accurately and timely, then interventions can be made accordingly to save lives.
Phone rings. An urgent call from the ETU regarding a diabetic ketoacidosis patient. The cycle begins again. A day at the lab is a race against time, where every second counts.